Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet, in our opinion. My name is Bob. I'm exactly one half of the Bob and Brad team, and I'm joined by Mike Keenitz, who is part of the Bob and Brad crew and has a channel in their own right, which covers Bob and Brad products and other products for review. So it is our extreme pleasure today to be, this is really going to be part of our expert series. We're interviewing people that are experts in their field. And today it is a great pleasure to have Dr. Deb or Deborah Riczo. Did I say that correct? Riczo?
It's Riczo, like Ritz cracker.
Oh, Ritz. Oh, Riczo. Okay. Dr. Deb.
Dr. Deb.
Yeah, Dr. Deb, if you'd maybe give just a little bit of your background so people can know who you are in case they aren't familiar with you.
Sure. I am a physical therapist, and I've been a practicing physical therapist for, I hate to say this, but
I know,
4 decades. So I worked for over 30 years at Metro Health Hospital, which is a county hospital, and got an incredible amount of breadth of experience working there, and focused in the last decade on orthopedics, and developed a method that is kind of the thrust of what my work is now, helping women with pelvic girdle and sacroiliac issues. So that's kind of plus in the 90s and the 80s, when people really weren't doing it, I had a business with teaching prenatal and postpartum exercise classes in the community. And I partnered with a couple other therapists. And so that was really fun. And I got to do a lot of program development and actually teaching the exercise classes. So I have a long history of being involved with women's health, specifically the prenatal and postpartum population, but women's health in general. So.
Awesome. And I'm going to just mention, you have 2 books. Do you have more than that? Or I'm familiar?
No, I don't. I started writing when I retired. That's why I retired when I did, so that I could actually, continue my journey.
I've read both of them, believe it or not, and they are excellent books. They're really written for the layperson, although the professional would get something out of it too, believe me. And the first one is called Sacroiliac Pain. That was your first book. And Understanding the Pelvic Girdle Musculoskeletal Method. And the second one is Back and Pelvic Girdle Pain in Pregnancy and Postpartum. Find relief using the Pelvic Girdle Musculoskeletal Method. Now, these are both on Amazon, correct? And OPTP and
yes.
Correct. Would be okay if we talk about the pelvic girdle pain a little bit?
Sure.
Okay, so I saw from your book that this is really common. You want me to give the stats? Or
Sure.
So during pregnancy, up to 56 to 72% of the women can feel pelvic girdle pain. And I thought what was more distressing was that 7 to 25% can have continued pain afterwards. So that is a large part of the population that have.
Yeah. So, yes. And then that affects, it affects their quality of life.
Oh, absolutely.
And it affects their relationships. It affects what they can do with their children and with their husband. It affects their livelihood. Sometimes when they go on disability, anxiety and depression have been widely associated with chronic pain. So there's all kinds of really not good sequelae for not having a good treatment, and kind of, that's why I do what I'm doing.
Sure.
So that we can try to help as many people as possible, specifically women, because most of the research has been done on women prenatally and postpartum for pelvic girdle pain, because that's the population that it affects the most. And I know that when I am treating a woman in menopause, often she'll tell me her first time when she had pain was during her prenatal or postpartum period. And then it may go away, but then it comes back, and it just really never goes away.
Oh, good Lord.
because they haven't addressed all the pieces and parts as far as their flexibility and their strength and their function and how they're moving to have it, to really be gone.
Sure. So I know our recommendation would be to check out this book. Well, I'd say this one actually, for back and pelvic girdle pain in pregnancy and postpartum. Now, I think this is a great starting point. Some people will probably alleviate their pain just by doing the self-treatments in here. But where would they find a PT, a physical therapist that is expert in this area?
The American Physical Therapy Association has a section called pelvic health. And so those are the therapists that are really specialized in working with areas of the pelvis and any type of pelvic pain, pelvic girdle pain and pelvic pain. So
if you go to their website,
you can go to their website, it's apta.pelvichealth.org, and they have a Find a APT
awesome
tab. I am also going to be rolling out, because I just launched my new website yesterday, but I'm going to be rolling out a PT section for therapists that have taken my course.
Oh, fantastic.
I have a one-day course. I used to actually teach a 2-day course, but now it's a 1-day course and it's virtual. And I'm going to be rolling out that section, and I'm going to contact people that have taken my course over the years and see if they want to be on that list, so that there will be reference for people literally. Now that it's virtual, it'll be for people literally all over. So that's coming. I haven't done that yet.
Okay. So and you can see her website was listed behind her, over her right shoulder, left shoulder, different how you're looking at her, but okay. So,
I went like this.
Do you mind if I ask, what kind of success rate have you had with SI and pelvic girdle pain? Do you have a sense of what, obviously you were doing quite well, because whenever people start finding the guru and start sending people to them, there's a reason. People are getting better. So, but
yes, I really, as long as people are compliant, that was the biggest thing, because sometimes people, so here's the thing, sometimes people feel better and then they don't do the whole package, So I don't have a hard number for you, because I haven't actually taken statistics, but the vast majority respond to this treatment. I even there's reviews on Amazon that of people that have had pain that I don't know and I've never touched, but people that have been through practitioners or have had pain for a number of years and they are getting relief. So to me, that's why I keep going, because I know that this technique, this approach, it's an approach which is a holistic approach. Like you cannot not get that mind-body connection, connect with your breathing, and do all that work and just do the exercises and then be real tensed up when you're doing them and like, oh, these don't work. It's a package. And then being aware of what you're doing during the day, how you're sitting, how you're carrying things. It's really, the whole method is all those things. And these specific exercises too.
Yeah, and it's very comprehensive. It goes through the pregnancy and also afterwards, and a lot of stretches. And I think you emphasize with some of the stretches towards the end of the book, you don't necessarily have to do every one, you certainly don't even have to do it on both sides. If you find one side is tight, you might want to focus on that side, and if vice versa. So
right. And so the other thing I wanted to mention, Bob, is that these exercises they're meant to be simple. They're meant to be, I call them remedial. So they're the first stepping stone to kind of get you going.
Sure.
And so they're not meant for that you need to do these for the rest of your life. They're meant that these are to get you where you want to go, where you want to be. If you want to get back to a sport that you were doing, or if you wanted to, go hiking for your exercise, that's where you want to go. You want to do things that you enjoy, but you want to have these are stepping stones.
Gotcha. Can you talk about the importance of strengthening the pelvic floor? It's interesting because I had read a book with the Kegels and stuff like that. And in their approach, they were really trying to have you focus on the pelvic floor alone and not the muscles around it. And it seems to be on your approach that you're wanting to like engage them at the same time. Am I wrong? Am I?
No, that's a very good observation. So there is a place for just doing the pelvic floor contraction. There is a place for that. And that is when women are having more specific issues with incontinence, pelvic organ prolapse, which is a common condition after pregnancy, and painful sex. So when you're having some of these issues, that's where the pelvic health therapist will come in, and they will actually evaluate the pelvic floor and then work on you getting a control back. Because see, those systems work automatically.
Mm-hmm.
And so if that automatic piece isn't working great, that's when they need to kind of work with that to try to get that system working properly. I incorporate the pelvic floor in the exercises because they normally would come in when you exhale. So it's just kind of bringing an awareness there. But if when you are exhaling and you pull your pelvic floor in, when you're breathing back in, that pelvic floor should relax down.
Gotcha.
So it should be doing this. And if it's only doing this, then we have a problem, Houston.
Right. If it's tightened all the time.
Yeah.
Yeah. Hypertone. Yeah. And that's exactly what you said. It was the case where it was for people that were having trouble with bladder problems and such. It wasn't other issues. It wasn't pain, except like you said, maybe with sex. But so thank you for clarifying that. When do you recommend the use of compression? This is a Facebook question. Was it yours?
No, it's mine.
Your question?
Those are all my questions.
Oh, when would you recommend compression pants, or maybe even the like maternity support?
I think that maternity supports will probably make most women feel more comfortable in that last trimester. Specifically, if someone's walking around and they're always holding their belly. Yeah, I don't know if you've been around many pregnant women.
I've seen that.
Women hold their belly. They for sure. That's a sign, because the abdominals are so stretched. They can only stretch so much, and that little bit of support helps. So in that last trimester, I think a lot of women would benefit. Financially, it's an issue because they're not, it would just be something else to do. But if you find that you're holding yourself like that, you're holding your belly a lot, you would benefit from a maternity support. And I know that some women would also benefit from the sacroiliac belt, just because the joints are just getting looser and that compression. Now, I didn't say this before, so I'm glad I had this opportunity, because anyway. So if you put on a sacroiliac belt and it makes you feel worse, it's a very good chance that you need to do the pelvic balancing exercises that I prescribe and get that balanced, and then put it back on. And then that works 9 out of 10 times. I haven't really seen that not work.
It makes complete sense.
Yeah.
Is there a time when compression pants are appropriate, or?
Oh yeah, a lot of women find a lot of support postpartum as well to having a compression pant. There is a compression pant out there that has a sacroiliac reinforced area around the sacroiliac area, and that is Supacor, and they're based out of Australia. And the reason I know is because they had contacted me to work with them, and then the pandemic hit. So they are looking to come into the United States and have a distributor and things like that. But they are advertising on Facebook and social media. I've seen their ads, but the product would actually be shipped from Australia.
Gotcha.
Oh, Supercore. Yeah.
Is this probably two?
They're all mine.
All right. How important is diet when it comes to pain management?
Well, you know that what we eat can influence inflammation.
Right.
There is actually called an anti-inflammatory diet, and you can find information on this diet on the Arthritis Foundation website. It's also known as the Mediterranean diet. So if we're eating a diet that causes more inflammation, then we're setting ourselves up for having more inflammation.
Right.
And that's why you take medication. Some people take medication is for that anti-inflammatory effect. And so if you can, diet's important.
Gotcha.
To answer your question.
Really anti-inflammatory type.
Yes.
Yeah.
Yes.
A lot of plant-based, quite often, Mike.
Well, meat doesn't cause inflammation.
Yeah. Okay. All right. Well, anyway, we just kind of got the tip of the iceberg there, maybe on pelvic girdle pain, and you're going to do a lot better if you check out the book.
Yeah.
Again, Back and Pelvic Girdle Pain in Pregnancy and Postpartum by Dr. Deborah Riczo. Yeah, there we go.
You also did a write-up on our blog.
Oh,
too.
yeah. Thank you very much for doing that, by the way.
If people just want to see a little short excerpt of a lot of these things, it's on there too before they buy the book. Like they could check that out as well.
Yeah, we'll put a link for that.
And I should have mentioned earlier that OPTP is running a 20% discount on the book.
Oh, great.
To help me celebrate my new website. So you just would go to my website and there'll be a banner at the top saying 20% off, and then you'll get a code. I'll send you a code, and you can get it for 20% off through the end of March, and then the sale goes away. And it's not an expensive book. It really
No,
isn't.
it's not. In fact, I don't know if you knew this, Dr. Deb. The way I found out about you is, we have some products through OPTP too. And their president had told me, or CEO had told me that she put they did an email blast of your first book, the SI book. That it was the best response they've ever had to a book.
Really?
Yeah, she maybe didn't tell you that, huh?
No.
Yeah, it was like, well, I want that book then. So that's when they sent it to me, and
these are nice for your average consumer too, I'd say. Because this book is 36 pages.
Right.
It's not like a heavy, dense textbook. Your pregnancy one's more. It's like 100.
It's more
pages,
comprehensive, yeah.
A little more comprehensive, but it's very easy reading, and there's lots of diagrams of how to do everything properly. So.